Good day, welcome back to our channel. In today's video, we look at temporary incapacity leave. Be aware that incapacity leave is not an unlimited number of additional sick leave days at your disposal as an employee. Incapacity leave is additional sick leave granted conditionally at the employer's discretion and is governed by the policy and procedure on incapacity leave for ill health retirement, often referred to as PILLA. If you have exhausted your normal sick leave during the prescribed sick leave cycle, and you, according to the treating medical practitioner, are required to be absent from work due to a temporary incapacity, you may apply for temporary incapacity leave with full pay on the application form prescribed in terms of PILLA in respect of each occasion. For your application for temporary incapacity leave to be considered, do remember the following requirements. You must submit sufficient proof that you are too ill or injured to perform your job satisfactorily. The application form must, regardless the period of absence, be accompanied by a medical certificate issued and signed by a medical practitioner that certifies your condition as temporary incapacity, and if you have consented, the nature and extent of the illness or injury. You have to provide any medical evidence related to the medical condition, such as medical records from a specialist, blood test results, X-ray results, or scan results obtained at your expense, and any additional written motivation supporting your application, and you are requested to give your consent that medical information or records be disclosed to the employer and or its health risk manager, and to undergo further medical examinations in terms of the assessment process prescribed in PILLA. As an employee, you must submit your application for temporary incapacity leave in respect of clinical procedures in advance, unless the treating medical practitioner certifies that such procedures have to be conducted as an emergency. If overcome by a sudden illness or injury, you are required to personally notify your supervisor or manager immediately. A verbal message to the supervisor or manager by a relative, fellow employee, or friend is only acceptable if the nature of and or extent of the illness or injury prevents you from informing your supervisor or manager personally. You are further required to submit an application for temporary incapacity leave personally or through a relative, fellow employee, or friend within 5 working days after the first day of absence. Your supervisor or delegate must, within 2 working days from receipt of the leave application form, recommend or not recommend the application and submit it to the relevant HR division in your department. If you fail to submit an application within the period required, the following arrangements apply. Your manager or supervisor must immediately notify you that if such application is not received within 2 working days, the sick leave period will be regarded as unpaid leave or annual leave. If you fail to submit the application on time or compelling reasons why an application cannot be submitted, your manager or supervisor must inform HR immediately, and the relevant authority shall approve such absence as unpaid leave or annual leave if you consent. Your supervisor, manager, or the head of department, or his or her delegate must, within 2 working days from receipt of the leave application form, recommend or not recommend and or approve or disapprove this application as submitted to HR. Failure by you to provide your application form within the stated periods, or failure by the supervisor or manager to properly manage it, must be viewed in a serious light, and disciplinary steps could be taken. The head of department must, within 5 working days from the receipt of the employee's application for temporary incapacity leave, conditionally grant a maximum of 30 consecutive working days temporary incapacity leave with full pay, subject to the outcome of his or her investigation into the nature and extent of your illness or injury, and refer the application with all its supporting evidence to the health risk manager in accordance with PILLA for an assessment and advice on whether the employee's illness or injury justifies the granting of incapacity leave, and which steps, if any, in accordance with the procedures contained in policy, are necessary. The head of department may request you, if you have consented thereto on the application form, that you subject yourself to 1 or more medical examinations by medical practitioners of the employer's choice and for the employer's account. If you fail to honor the appointments for such medical examinations, you could be held responsible for any fruitless expenses incurred. The HOD must, within 30 working days after receipt of both the application form and medical evidence referred to, approve or refuse the temporary incapacity leave granted conditionally. In making this decision, the HOD must apply his or her mind to the medical evidence, information, or records, if you consented to disclose, the health risk manager's advice, the information supplied by you, and all other relevant information available to the HOD, and based thereon, approve or refuse the temporary incapacity leave that was granted conditionally on conditions that the head of department may determine, for example, to return to work, etc. The head of department may, on the basis of medical evidence gathered during its investigation, approve the granting of additional incapacity leave on conditions that he or she shall determine. The HOD may, for this purposes, grant conditional further temporary incapacity leave. The HOD, if applicable and as soon as possible, must, after the receipt of the health risk manager's advice, decide on the possibility of securing alternative employment for the employee or adapting his or her duties or work circumstances to accommodate his or her incapacity or alternative employment, and as soon as possible, approve and implement a plan of action for this purpose. If the HOD approves the temporary leave granted conditionally, such leave must be converted into temporary incapacity leave, or refuses the temporary incapacity leave granted conditionally, he or she must notify you as employee in writing of the refusal or of the reasons for the refusal, and that you must notify the HOD in writing within 5 working days of the date of the notice to you whether or not the period of conditional incapacity leave must be covered by annual leave to the extent that you have it available, or unpaid leave, and that if you fail to notify the HOD of your choice, the period will be covered by unpaid leave. Further, that you may, if you are not satisfied with the HOD's decision, lodge a grievance in terms of Section 35 of the Public Service Act of 1994 and as amended. In instances where incapacity leave is declined, which originated in the previous leave cycle, you have the option to the period covered by unpaid leave or to request that annual leave of the current leave cycle be utilized to offset the declined incapacity leave. Do also note the following with regard to the acceptance of medical certificates. For the purposes of normal sick leave, medical certificates issued and signed by the practitioners and persons who are certified to diagnose and treat patients and who are registered with the following professional councils established by an Act of Parliament shall be accepted: the Health Professional Council of South Africa, the Allied Health Professional Council of South Africa, the South African Nursing Council. The registration details of service providers could be confirmed with the above-mentioned councils. A medical certificate must contain the following information: the name, address, and qualifications of the practitioner or person, the name of the patient, the employment number of the patient as applicable, the date and time of the examination, whether the practitioner issuing the certificate as a result of personal observations during an examination or as the result of information received from the patient, which is based upon the acceptable medical grounds. If the patient has given informed consent for it to be disclosed, a description of the nature and extent of the illness or injury in layman's language, whether the patient is totally indisposed for duty or whether the patient will be able to perform less strenuous duties in the work situation, the exact period of the recommended sick leave, the date of issue of the certificate of illness, a clear indication of the identity of the practitioner or the person who issued the certificate, the initial and surname in block letters, and the registration or practice number of the practitioner who issued the certificate. If the practitioner is using pre-printed medical certificates, wording not applicable to the patient must be deleted. The HOD must accept medical certificates that do not describe the nature and extent of employee's illness for sick leave taken during the normal sick leave cycle, that is 36 working days in a 3-year cycle. The employer may request from an employee a medical certificate describing the nature and extent of the illness before granting sick leave if the employee abuses the system during the normal sick leave period of 36 working days. In other words, a pattern of regular sick leave is on display. Despite the aforementioned requirements, for the purposes of temporary incapacity leave, the employer only accepts medical certificates issued and signed by practitioners registered with the Health Professional Council of South Africa and are legally certified to diagnose and treat patients. Such medical certificates must describe that the illness or injury is temporary and, if the employee has given his or her informed consent, the nature and extent of the employee's illness or injury. This brings us to the end of this video. In the next video, we will focus on permanent incapacity leave. In the meantime, do subscribe to our channel and activate the notification bell to receive alerts when a new video is released. If you found this information useful, do press the like button as well. Until next time, goodbye.